5 or 6 minute segment recording me, and if we get the back of your heads, will that matter? You know, if you want to put a smile on the back, we got some ink. We can put a marker back there and put a smile back there. Put some teeth back there, you know,
Just
whatever.
flip your mask.
Yeah. So we'll probably do just a good maybe 6 or 10 minutes of filming. Okay. If it gets too hot in here, let me know and I'll put the fan on. Okay, we're going to try you out. No, we're going to have to scoot you over just for a little bit, or else I'm going to take the back end out. Okay, good. Okay, one of the, so how many of you, I know a few of you, but I'll just introduce myself. How many of you have been here before? Okay, my name is Sharon Williams. I'm a registered nurse. I've been a registered nurse for 38 years. I'm a veteran. I've worked from Spalding Rehab to nurse case managers at skilled nursing facilities. I've spent 19 years as a home health nurse. I worked in the field, and then excuse me, I worked in the field, and then I worked my way up to the director of clinical services, and I've been a director of clinical, I was a director of clinical services for about 5 or 6 years before I started Optimal Healthcare Solutions. Just a minute. Let's see. So that's about me. Now I want everybody to introduce themselves. We'll start with Medi, and let me know if you're medical or non-medical, so I know who I'm speaking to.
My name is Murthy. I'm also a registered nurse in owner of a medical and home health care, and it's medical.
My name is Sarah Patterson. I am a case manager for Sages Elder Care, and we are non-medical.
Sakita Allen, non-medical, alternate manager at a World of Excellent Home Care.
Okay.
And Ehab with Affirmative Home Care. I'm the administrator and the owner, and we are non-medical.
Hi, my name is Sonia. I'm from Seniors Helping Seniors, and we're non-medical, and I'm just an alternate manager.
Okay.
I'm Marilyn Supad. I'm the fielders for Object Care Health, and I beat you. I'm 42 years in RN.
Okay, all right. Now, you know what it's like to really get in there and put those thermometers, jab it down their throats, and okay. The other day, I was talking to one of my patients, and she told me, she said, Sharon, I always wanted to go streaking, but I was afraid to do so. So one day I was sitting in the house and I thought, in her apartment, she goes, I thought maybe I ought to go streaking now before it gets too late. I'm 92 years old. So she put on her robe and she opened up the door. She looked to the left, then she looked to the right, and she said, okay, I thought everything was clear, and I took off running. And I got around the corner and there was two men sitting on the bench. And one of them said, hey Fred, did you see that? Fred said, yeah, and whatever it is, it needs ironing. Okay. Okay. Let's see. Years ago, Bill Hickenlooper put into policy, he wanted to have things that are in place for seniors to age in place, okay? And he said no matter if it's a nursing home or if it's assisted living or they're in their own home, we want to put infrastructure in place so they can age at home. So they created a committee called the Colorado State Strategic Action Plan. And what they do is they give recommendations to the governor on what should be in place so that seniors can stay at home. And then John Hickenlooper, no, what is our mayor for Denver? Hancock. Hancock decided he was gonna jump on that bandwagon too. And so what we talked about was the sidewalks being repaired, and because people can't walk. If they went to walk with a walker, they couldn't because of the uneven sidewalks and so forth, and it's really true. One of the other things is back in 2015, several committees got together and they, no, it's kind of old, but one of the things they told the governor is that we weren't really ready for a lot of seniors to be at home because there's not enough training going on, and he wanted to know what were we lacking in. And one of them was, a couple of them are in here, addressing dementia, fall prevention, diabetes, and suicide prevention were some of the topics that they brought up, and you can pass these around and just look at that. Okay. And for some of you who've been here before, you already know the statistics. Mesa County has more people that are 90 years of age than in Denver. In 2010, that we had 340 million baby boomers, and that was 26% of our population. By 2030, it will increase, and we are becoming one of the fastest growing states for seniors. We will have a population that's higher for people that are 65 years of age and older. By 2030, there will be 5,000 people in Colorado that are 100 years of age and older. The average person moving to an assisted living facility is 83. The sad thing is, by 2040, which is around the corner, there will be 160,000 people in Colorado living with dementia. By 2030, Medicaid care for seniors will go from 1.4 billion to 2.325 billion. So we have to be prepared. We got to make sure that our staff is trained and the surveyors are out. How many of you had any surveys this week? No, I've had at least 3 people call and say that they were being surveyed. And some of them have really messed up. So we gotta make sure we be careful. You never know when they're gonna pop up like weed. As soon as you get rid of one weed, another one pops up, So today we're gonna talk about some of the basics that the state requirements are. Licensing of Colorado. In order for you to understand what the different levels of services we offer in the home health industry. So I'm going to give you a little background history. Home health services started back in 1813 in South Carolina. In 1877, Visiting Nurses Association was started. And in Denver, in 1889, Denver, the first Visiting Nurses Association started. And how many of you know Dominican Sisters? Okay. In 1922, Dominican Sisters were started. It was a home health agency. Unfortunately, in 2014, when the last sister passed away, that was my last job, was at Dominican Sisters, and I loved every bit of it. After she passed away, they had to change it from Dominican Sisters to Dominican Home Health. Yeah, because there was no more sisters. Okay. I'm going to skip down to, in the 1970s and the 1980s, Medicaid waivers was started. And then in 2000, we had a couple of wonderful nurses from the University of Colorado that decided they wanted to help Medicare save money, so they created the Oasis. Thank you. Yeah, so that's why we are struggling and having to deal with a 20-page assessment form. You know, thank you, nurses at University of Colorado. And in 2009 is when they required all this mumbo jumbo about different agencies being licensed in different levels and so forth. And in 2011, they created the Class A and the Class B. And in 2001, IHSS was created, but they started on the regs on that, but they didn't implement it